Welcome to this year's Seniors Fair hosted by the Schreiber Senior Centre. Cathy Carlino, the center's coordinator, has invited many guest speakers to come out and talk about all kinds of health topics related to seniors. In this three-part series, we will be looking at early cancer screening, dietary choices, hearing loss and treatments, raising awareness of scammers targeting seniors, as well as the dangers of traveling on highways 11 and 17. In this first part, we will be hearing from the North of Superior Healthcare Group. With a growing aging population, the organization has identified the need for more accessible programs focused on prevention, timely diagnosis, and ongoing support. We will also be meeting some of the other groups that were on hand to offer services specifically related to seniors.
Hello everyone again. We're going to try to keep you guys up to my schedule. And then I'm going to call forward our mayor, Kevin Mullins.
On behalf of myself and council, I would like to welcome everyone to the 3rd annual Seniors Active Living Fair. We are a tight-knit community full of family tradition, pride, and great heritage. Welcome and enjoy the day.
I'm just going to ask Dan to give us a couple words. Again, he's invaluable for the Senior Centre. Dan's our representative, council representative, comes to all our events and hasn't ever missed one. And always supportive and not scared to roll up his sleeves. So here you go, Dan.
Thank you, Cathy. Welcome everyone to this health fair and to the first day of daylight savings time. I was never a big fan of spring ahead, but rather enjoy fall back better. So, as Cathy said, I am council's rep for this committee. I would like to thank the committee, and Cathy introduced them all earlier. I've been the council rep for the last 7 years for this committee, and hard work and digging in and getting things done with Cathy and her network of friends and community members. It's never ending. The committee is also supported by Tammy Ivey, the Director of Operations, and her staff, and also by the administration from the Township of Schreiber, who, and I believe they're underappreciated, but they're always there to help us. So this is why we're here today, to socialize, to learn, and to have fun. Many thanks to all the presenters that showed up here, even though with the challenge of the overnight snow, and also getting out of bed early on this first day of daylight savings, and giving up their day off on the weekend to be here with us. So, please take the time to visit all the booths set up for our benefit and enjoy the rest of the day. Thank you, Cathy.
Thanks so much, Dan.
We're the North Shore Family Health Team, and we're here to promote health and prevention and management of illness and chronic disease.
So our first presenter, Mary Dingwall of Rossport, began her healthcare career in 1994 as a recreation therapist at the Lincoln Psychiatric Hospital. After earning a social work degree in 1997, she worked with North of Superior programs in Terrace Bay and Schreiber. In 2007, she joined the North Shore Family Health Team as a social worker. Since then, her support for the people of Schreiber, especially its seniors, has been exemplary. After completing a master's in health management from McMaster's University in 2017, she became executive director in 2018, and she really does go to bat for our seniors, and she's got a few words she wanted to talk about. You can run, but you can't hide.
Thanks, Cathy. I just want to say, as part of the North Shore Family Health Team, it's really nice for us to just show up at a health fair and not have to organize it. So to have you organize these for the seniors and for us all to attend is really great. So hopefully you can keep doing it. So I have one of our team members with me today, and she's going to do a little talk as well, Lisa Timko. And for those of you that don't know Lisa Timko, she's our go-to girl. So she's an RPN that does our care coordinating, and she knows what services are around, what services aren't around, and if there's a service not around that you need, she'll do her best to try to get you connected to it. So she's a wonderful resource for people. She participates in our memory clinic as well, and she's an RPN, and you might get vaccines and different things from her as well. So she's going to talk in a minute. The rest of our team is not here, but everyone is very involved in seniors care and then other care. So Andrea and Lindy are our dietitian and our RPN, and they do the DEP, the Diabetes Education Program, and they're also the ones that come out to the senior centers and to Collingwood Court and do blood pressure and blood sugar clinics. So if you have any questions, Andrea is great with any dietary questions, any illnesses that are going on that you need guidance on, and then Lindy's RPN, they're both got their diabetes educator certificates. So, and then we have Kim, who most of you might know as our NP, so she replaced her aunt Sue McConnell when she came on board 2 years ago, and she's quite active in the community as well. And then we have a new team member that just started. So Elizabeth, that you know, has just started as our counselor. So she's an RN. She worked at the hospital for a number of years. She has a really strong background in palliative care, and she's going to be doing counseling for us. So if you have any questions or any counseling, you would reach out to Lisa, and she would do an intake. And then if Elizabeth's skills meet your needs, she'd send you to Elizabeth, and if not, she'd find out where else is the best place for you to go. So that's our team. And then Jay Stokes has a new physician. So Dr. Japana is the new physician at Jay Stokes, and she's rostering, so you can go see Debbie and Allison and Ashley there, and they'll roster you with her. So we're really excited to have her. Yeah, can I explain what rostering is? So within our communities, we're called a RNPGA, and I don't know exactly what it stands for, but our physicians are funded to do everything in the community. So even though you don't have a doctor that you've signed on to, you still get service through the nurse practitioner, through the other physicians, and through the locums. But you can also sign on to a doctor. So the people that were Dr. Hurst's patients kind of got orphaned when he left. But now you can roster, so you go in and you sign a paper, and then that goes to the government, and that means you're linked to that doctor. So if there's correspondence, and Lisa's going to talk about screening in a bit. So if there's screening that the government's doing, it comes out if you're rostered to the doctor. I think that's the best way to, yeah, okay. I'm looking at Debbie for confirmation there, so I'm going to pass you on to Lisa, and she's going to talk about the screening. We do a quality improvement plan every year, and this year we really want to get people up to date on their screening, on their preventative screening, because it's so important. It can save you difficulties in the long run, and it can save the healthcare system a lot too. So, Mary, did you have a question? Okay.
Hi everyone, as Marilyn said, I'm Lisa. I'm an RPN with the Family Health Team, and she asked me to speak to you guys in regards to cancer screening in Ontario. It's a super high priority for our own physicians and self-care in Ontario to raise the rates of screening. So I'm just gonna remind everybody the importance of it and what it is. So cancer screening is an important part of preventative healthcare. It helps detect cancer before symptoms appear, when it is often easier to treat. Early detection can significantly improve survival rates and reduce complications. In Ontario, cancer screening is organized by Ontario Health and Cancer Care Ontario. These programs help ensure that anybody that is eligible has access to these screening services. Most are covered by OPEC. Ontario currently has 4 major organized cancer screening programs, which include one for breast cancer, cervical cancer, colorectal cancer, and lung cancer. Breast cancer screening uses mammography and is recommended every 2 years for people aged 40 to 74. Cervical cancer screening now uses HPV screening, which is a little bit different than the previous type of screening that was used, and it is now recommended to be started at 25 and repeated every 5 years. Colorectal cancer screening uses FIT testing, it is fecal immunochemical test called FIT. And that is recommended every 2 years for adults aged 50 to 74. These screening programs aim to detect cancer early and identify precancerous changes so treatment can begin sooner. Why is cancer screening important? It is important because it saves lives. Detecting cancer early often means the disease is at a more treatable stage that can lead to better outcomes, fewer complications, and improved quality of life for patients. In some cases, screening can prevent cancer entirely. For example, colorectal screening can detect precancerous polyps that can be removed before they develop into cancer. Because of these benefits, increasing participation in screening programs is the key goal of Ontario, the healthcare system in Ontario. Family health teams support cancer screening in many ways. We use our EMAR, our electronic medical record, to identify the patients that are due for screening. This helps us track which patients need tests like mammograms and FITs. Some of you guys may have received phone calls from myself before and trying to increase our numbers to call you and let you know that you're due for a mammogram and to encourage you to go to the screening for late funds. Some things we do directly include, like your cervical cancer screening, and we also help coordinate referrals to for mammograms. What else can I say? Cancer screening programs in Ontario play a critical role in early detection and prevention of cancer, and we're doing our best to support these programs. There are some different levels of screening, so people that are high risk, they follow a different schedule for screening. And if you have any questions about that, and if you're high risk, the best thing to do is to talk to your doctor or your nurse practitioner. And I did just want to mention that there has been some changes, if you're not aware, to the screen related coach has had some mechanical issues. So for this season, we won't see them come to Terracing and Schreiber as they did at this time. But they will be a marathon from April 24th to May 24th. And for those that don't know, you can also have your screening completed on the screen related coach when you're in Thunder Bay. So during the winter season, they're typically parked at the superstore or travel through the city. And all you have to do is call the 1-800 screen relay number. So it's 807-684-7777 to book if you're in the city. And I've done it myself. It's super convenient. And yeah, that's it. Any questions?
Thanks so much, Judy. And they're going to be in the corner doing blood pressure, blood sugar tests. Again, they do come, they do come once a month. It's the last Wednesday, their sign languaging me over there. I haven't taken that course yet, but I'm working on it. Once a month, every last Tuesday from 2 to 3, they're there doing blood sugar, blood pressure. I noticed someone came off the highway. First I have to go give her a hug and see if she's ready to say something.
How are you?
I just got a reminder, I'm actually the critic for seniors. That's part of my responsibility, seniors and accessibility. And one of the things that the government funds, as you know, I'm in the opposition, but one of the things that I'm really happy about is that they fund these events. Because look at the number of people here. So that is part of my responsibility, to be advocating for seniors. Let me know, and I hope you notice that I'm not afraid to get up and give them help. And you can go over and talk to Julie.
My name is Julie. I'm with the OACAO, the Older Adult Centres of Ontario, funded by the Ministry of Seniors and Accessibility. And we are one of the sponsors and funders of today's event, as well as we're here sharing provincial services, whatever you need around dementia, falling, abuse, maintaining your home, power of attorneys, consumer protection, all services that might be related, that might be interesting to anyone provincially.
I'm Linda Williamson from the Schreiber Public Library.
And I'm David Costa.
So the Schreiber Public Library is pretty much the hub of the community. Neither you. It's the Senior Centre or the Schreiber Public Library, and they continue to do, when people say to me, there's not much for the kids to do, they continue to do programming and outreach, and they provide books. I know because my grandbabies talk about it all the time. So I'm in Linda and David, either one who wants to talk.
So what Cathy's talking about is we have a monthly book day for the children. So each month they have a book, 2 books, mazes, word search, and crafts, whatever the theme of that month is. And it's all free. So if you have any little children that you'd like to sign up for that. Another thing that we're doing for Heritage Days is we're asking people to tell their story and about Schreiber. And it can be written or typed, it can be audio, video, anything like that. It doesn't have to be very long, it can be anonymous, it doesn't matter. We just would love to hear everybody's story about Schreiber. And another thing is we have our strategic plan. We just completed it, so the brochure is here if anybody's interested in looking at it.
We're so blessed to have a library that's fully automated and provides so much to the town people, for sure. Thank you to both of you. And my seniors know that David's our go-to if they have any trouble with their laptop or iPad or phone. He's the gentlest boy. He's a man, but he's the gentlest boy. So there you go, Dave. Sorry, you're going to get more people. And last but not least, Linda or Cathy, you want to say something? Cathy, I know you're shy.
Well, Linda and I are here today representing the North Shore Harvest Cupboard. As most of you know here, the North Shore Harvest Cupboard is our local food bank. We have a site in Schreiber and we have a site in Terrace Bay. We're open once a month on a Wednesday, in the morning in Terrace Bay and in the afternoon in Schreiber. We do have donation bins. I think we still have them in both grocery stores. We do accept donations through an e-transfer. We try to be active at many events in the community just to keep the fact that we do need a food bank in our small communities on the top of the mind of people. And I will say we do have very, very generous community members that support our food bank. We're a member of the Regional Food Distribution Association in Thunder Bay. And the food bank here in Schreiber is behind the dollar store. And again, the township of Schreiber is wonderful to us. You know, with this snowy winter, they clear out the space so that our clients can get in. And we just thank you again for being so supportive. You know, people would say, well, there's no one in our small towns that need the food bank. Well, that's not the case. Everyone knows how expensive food keeps going up and up. And our clients are very, very appreciative of the service we provide. So thank you. We have to make a donation to the food bank today. You can put your name in for a draw. We have pamphlets here that list our board and the times that we're open. And we also have a volunteer list. We don't have any names on it here yet today. And we're not asking you per se to join our board. We're asking you to maybe, when we're open once a month, we might need some help. We might need some help filling our shelves. And that's all we're asking you to volunteer for. I mean, if you want to come on our board, you're more than welcome. But this volunteer list we've got here is just in case you have a little bit of spare time and you can help us out in some way. So thank you again.
If you have any ideas, sky's the limit, guys.